Hi all. This is Maeve Sundstrom, and we are here today, or I am here today, for the Choosing a Birth Location call for parents. Today is Tuesday, February 25th, 2025. There were a number of folks signed up to join today, but so far I'm the only one in the room. So what I'm going to do is go ahead and just begin the presentation. If you're watching the recording, you may see folks arriving, or it may just be a recorded presentation that I've prepared. Also a note about timing. I planned our presentation with some room and some space for discussion and for some experiential practice. And so we may run a little bit ahead of time given that we may not have a live discussion going on. So my plan is to leave some space in the recording for your reflection, and we'll just see how our time levels out. But I hope that this is useful to you as you are considering your birth location and making this important decision. So first, I'd like to just introduce myself a little bit more. My name is Maeve Sundstrom. I am a licensed midwife with a primarily home birth practice in the San Francisco Bay Area, California. I'm also a birthing from within mentor, childbirth educator, and facilitator. So part of the professional training team here at Birthing from Within, primarily teaching in the Birth as Heroic Journey program, Crossing the Threshold, and our live immersive Doula from Within, although you may see me other places as well. So although I'm a home birth midwife myself, that isn't necessarily the focus of today's call, although we'll cover that. And if there are any questions, particularly about home birth, out of hospital birth, I'm a good person to contact. You can find my contact info on the Birthing from Within website if you want to reach out and have a conversation. But I also, as we're beginning, I just want to name that Birthing from Within has a wide reach. So here I am in my local community, Redwood City, California. But I recognize that in different places, different states, different countries, and different communities, there will be variations in what is available as far as birth locations, how choosing a location happens, what the practical considerations are. Those will vary somewhat. So I'm going to speak from my experience, personally and professionally, as well as what I know from mentoring folks in different places around the country and the world as part of Birthing from Within. But please forgive me if there's any inaccuracy in here pertaining to your specific birth location. And feel free to let me know, let us know if you have updates or better information. All right, so the purpose of this class is to present some information about different options that are available to you as you're considering where you want to give birth to your baby. It isn't about advocating for or convincing in any direction. There are valid reasons for choosing any kind of birth location. So I'm going to present some information about different locations that are available, how to think about them, maybe some pros and cons or what's available or unavailable, what's different, benefits and risks of different locations. And then I'd like to dive a little bit into your process. So I can provide you all sorts of information, and that's great. There's a part of us, a part of our mind, and a part of our being that wants and needs to gather information from the outside, from a class like this, from a conversation, from a book, a website, social media, etc. A part of us that is looking outside for information. And especially if this is new for you, perhaps your first baby, or maybe you are having a subsequent baby and considering a different kind of birth location from what you used before. It's important, right? It's important to look around and see what's available. You'll have questions about all of that. And that's the work of pregnancy, right? Is to consider all of these choices and, eventually settle on the best combination of factors for your personal situation. We might, in Birthing from Within language, even call that part of you the gatherer archetype. So if you hang around Birthing from Within spaces, you will probably hear more conversations about archetypes. And what I mean when I say an archetype is just really an energy, a universal piece of being human that expresses itself in certain circumstances and situations. And so one of the archetypes, one of the parts that shows up as we're preparing for birth is the gatherer, who is looking around and deciding what to gather into the metaphorical basket. What information do I need? Who do I need to talk to? Where should I give birth? What book should I read? What class should I take? What do other people think about this? What do others know that I don't yet know that maybe I want to learn or could benefit from? And so the first part of today's presentation will be talking to the gatherer, right? Information about the different birth locations. And then we're going to shift gears a little bit and invite in and activate another archetype, another part of self, another part of parents that can show up as a very helpful presence. And that archetype we tend to call the huntress or hunter archetype. Now, the energy or the idea behind hunting is a little bit different from the energy behind gathering, right? Gathering is about looking around and kind of picking up what's here and picking up what's there and gathering it into the basket. Hunting has more of a quality of looking inward. When we hunt in this model, in this language that I am sharing with you today, when we hunt, we're primarily hunting inside. And what I mean by that is we're turning the lens into our own inner world, the part of us that no one outside would be able to explain or shed light on for us, right? There's a part of the process that involves your own internal preparation as who you are and who you're showing up as, all of your lived experiences up to this point, the particular environment you find yourself in, your social relationships, and your own sense of inner knowing. And when we hunt on the inside, we bring our patience and our persistence, our alertness, and our flexibility. These are all qualities of the huntress or the hunter. And when we bring those qualities to our internal preparation, our internal seeking and hunting, we can uncover insight, information, knowledge, wisdom, new questions that we never could have Googled, right? You have questions inside of you and answers inside of you that I could never ask for you and I could never answer for you. And so in today's presentation, as well as in everything we do in Birthing from Within, we're looking to combine these things. Looking around, gathering information, making connections, and hunting within. So with that, let's begin with just a little bit of an overview of the different kinds of birth locations that are available and some things you might think about as you're considering them. So the first one we will talk about is the hospital. In the modern world, the developed world, most places, especially certainly in the US and many other places in the world, the hospital is the primary location that folks are giving birth. There is quite a bit of history to, how we got here and why that is. We're not going to go into that, but I do want to just invite you into a consideration of the idea of how did birth land in the hospital and what message does that give me about birth? What message might I have been walking around with somewhere in the back of my mind about birth, maybe all my life, because of the dominant way that birth happens in our modern world? I don't know if any of you out there listening grew up watching A Baby Story, or I'm sure all of you have seen portrayals of birth, particularly hospital birth, in the media, movies, and TV. Maybe you've been through it yourself, or there are family stories about it. So just take a moment and reflect on, what does it mean that birth is occurring primarily in the hospital? And what ideas or beliefs or emotions or feelings might happen for me as I consider that reality? So I'll just pause for a few breaths while you think about that. Okay. So if you want more time, you can of course pause the recording and make notes, make art, think about it if you want to. Um, None of this is to say that hospital birth is bad or that there's anything wrong with it. I just wanted us to take a moment to check our assumptions, right? This is the default. How did that happen? And what does that bring up for me? So for many people, a hospital is really their only option for where to give birth. And that can be due to location, proximity. It can be due to health status, higher risk pregnancies, or need for medical care in pregnancy. Hospital birth can also have to do with accessibility and cost. In the US and many other places, health insurance will cover hospital births, and that's an important consideration for most families. A hospital is a wonderful place to be if you want access to pain medication in labor, especially things like epidural, or narcotics like fentanyl. That's all available to you in a hospital. Hospitals have a variety of types of staff available. So most hospital births are attended by physicians, OBGYNs primarily, although in some places, family practice doctors, family medicine doctors, or osteopaths also attend hospital births. There are midwives who work in hospitals, primarily nurse midwives in the US. That's our dominant system, that typically midwives in the hospital are nurse midwives. And then there are also other folks on the team. Nurses will provide a lot of the care when you are in labor in the hospital. Doctors or midwives who are managing the care will kind of come in and out and be more of a background presence until it's almost time for baby to emerge. And most of the care, sort of run of the mill, general routine care is happening with nurses. So one benefit of being in the hospital is there is much greater and faster access to emergency services, pain medication, surgical birth, cesarean birth, NICU, so neonatal intensive care if a baby needs extra support after being born, respiratory therapy, any kind of testing or scans, MRIs, x-rays, etc. All of that is available. Also, medical inductions are available in the hospital. Often lactation consultants are on staff. So in a way, a hospital is a one-stop shop. There's a lot available there. On the flip side, a downside to the hospital can be that there might be a lot of people involved in your care that you don't necessarily have an ongoing relationship with. Depending on where you are in the world, it's possible that your prenatal care provider will also be present in the hospital for your labor and birth. But in many places, including where I live, that is quite rare. Usually, hospitals are operating on an on-call staff system. So there will be a group of doctors or midwives, and they take shifts on call. And when you go in to have your baby, you're cared for by whoever is on shift. There will be shift change with nurses, doctors, anesthesiologists, you name it. Generally, folks are working on shift rather than there for the duration. The upside of that, you have fresh care providers. The downside, it can be hard to build a relationship. And if you're there for a while, like for an induction, or if there are complications afterwards, and you're there for longer in the hospital, it can be hard if there's not, a consistent continuity of care, ongoing relationship going on. Yeah, I think that's a good introduction to hospital birth. Like I said, for many people, that is the most accessible option. It tends to be the most socially normal option, which can be meaningful to folks. Having a baby is not just a one-day event. It is not just a medical event. It is a social event, a psychological and emotional event. It is impacting us on every layer of who we are. And so, as we're considering some of these nuts and bolts things, I want to just invite in that making part of your decision based on what feels right in your community is another thing to consider that is valid. All right. So the next birth location I want to give just a general overview of is freestanding birth centers. Now, this term means different things in different parts of the world and different communities. So I'll do my best to kind of cover that. Although, there could be information that is missing from this presentation. So do your own research. Let us know if we can do better. So freestanding birth center can be related to or connected to, affiliated with a hospital. Some parts of the world, some states have what are known as freestanding birth centers that also have a hospital affiliation. So often, if that's the case, the birth center is located near the hospital, possibly on the same campus or very nearby. There may be physicians on staff for both hospital and birth center. More often, birth centers are midwife-led, and that could be nurse midwives, it could be licensed midwives or certified professional midwives. There's lots of different types of midwives. Birth centers are often midwife-led, and part of the reason for that is that typically a birth center is an option for low-risk pregnancies and births. So births that don't need to be in a hospital for a medical reason. But a birth center, a freestanding birth center can work well for someone who wants proximity to a hospital, closer access, but doesn't feel a need or desire to be actually planning to give birth within the hospital. Sometimes hospitals will call their labor and delivery unit their birth center. So that's just a distinction to be aware of if you are looking around, touring places, depending on where you are. If you are looking at a hospital and they mention their birth center, you might want to just check, like, is that a freestanding place? Is that within the hospital? Is that different from labor and delivery in some way or not? It may be one and the same. They just call it their mother baby unit or their birth center, but it is essentially, a hospital labor and delivery unit. Another category of birth center is also often called a freestanding birth center or an independent birth center. And that is a location for birth that is not affiliated with a hospital in any way. Um, Occasionally, there are physicians affiliated with them, maybe on staff or maybe consulting. More often, independent birth centers are midwife led, owned and run, and staffed by midwives. Depending on where you are and what community you are in, a freestanding or independent birth center may have some sort of hybrid options between what's available in a fully staffed hospital in terms of pain relief, emergency procedures, etc., different types of staffing, or they may be more similar to a home birth setting. That just is a birth that's not taking place in your home. So we're going to talk about home birth in a minute. I won't go too far into that, but just wanted to note that sometimes a freestanding or independent birth center will be a little bit of a hybrid as far as resources between like a home birth setting and a hospital setting. Or an independent birth center might be quite like a home birth in terms of staffing, resources, emergency equipment that's available. It's just that there's a place for you to go. So an independent birth center might be an option to consider if you feel like, for whatever reason, you're interested in home birth or birth really outside of the hospital, but for some reason your home doesn't feel like the right place or the most appropriate place to be for whatever reason. Maybe you live with family members or roommates and you don't feel comfortable giving birth there with them. Maybe the distance is too great from where you live to care providers or to a hospital for emergency care if you needed it. Maybe you feel like you want more space, although I will say, as a home birth midwife, space is rarely an issue, and I've done lots of births in small spaces. But that is meaningful to some people. Maybe you're traveling from out of town and you'd rather give birth in a birth center than give birth in an Airbnb or hotel room, which some people do. Or you just want a space, a dedicated space for birth that's outside of your home. Maybe you have other children at home and you're hoping for the space and ability to focus on this pregnancy and this birth away from other children. So there's lots of reasons why someone might choose a freestanding or independent birth center. Oh, there goes my own kiddo you just saw in the background. Bye. Okay, so a freestanding birth center that is staffed by midwives typically will not be doing medical care like medical inductions, epidurals, or any sort of pharmacological pain relief. Some do have nitrous oxide as a pain relief option, so that's something to ask about. Freestanding birth centers will have some ability to manage childbirth complications and emergencies, typically medications available for bleeding, neonatal resuscitation, oxygen available, that kind of thing. They will have the ability to do routine care postpartum for the birthing person and the baby, so newborn exam, newborn medications may be available. But again, a freestanding or independent birth center will not have the ability to do surgery, for example. Typically, things like blood transfusions, cesarean birth, or ongoing management of bigger or longer lasting complications would entail a transfer from the birth center into the hospital. And what a transfer looks like is going to be very different depending on your setting, proximity, what's available, what type of licensing or hospital privileges your provider has or doesn't have. And there's really too much there for me to go into on this call. But that's something to ask care providers about if you are interviewing or looking around. What is your transfer protocol? What happens if we're planning birth outside of the hospital and we need to change gears and access medical care. What does that look like? What happens? Who's there? What do I need to know about the process? Where would we go, etc. All right, so moving on now to the home birth option. So a little bit of background about home birth. Laws, regulations, and practices regarding home birth vary greatly from community to community. Here in the US, every state has different requirements and legal status for home birth. So depending on where you are, that might be your first step, is to check out like what's available and what's legal. There are quite a few states like California, where I live, that have licensing for out of hospital, like community midwives, home birth midwives like me. So my license allows me to order lab tests. It allows me to administer certain medications. It involves emergency skills training. I can, sign off on disability paperwork for people. There's a fairly broad scope of practice that's available to me with my midwifery license in California that allows me to offer a pretty broad range of services, supplies, equipment, etc., to clients who are choosing to plan a home birth. There are other states where that is much more restrictive. Some of what I can do, they can do, and maybe other things not. And there are even some states where there is nothing on the books about home birth and midwifery. There are really no regulations. And a few places where home birth is illegal. And that will be the case around the world as well. There will be other countries around the world that have very much regulated and licensed midwifery for home birth, and others that don't. So that's going to be your first step if you're interested in considering a home birth, is just to find out like what's available, what are the regulations where I live. I'd like to say a little bit about who is a candidate for a home birth. That's a really common question. People are like, well, I've kind of heard about this option and maybe it sounds interesting, but how do I know if I qualify? How do I know if I am a candidate for home birth? So home birth is generally for low risk pregnancies and births. The exact definition of low risk will vary depending on provider type and where you are. But essentially, that's the first criteria. No major pre-existing health problems, no major concerns with this pregnancy, either in the pregnant person's health or the baby's health. There are reasons why someone might risk out of home birth partway through their pregnancy or partway through their labor. And again, that is kind of too big of a topic to cover here and will depend a lot on provider type, location, what kind of backup is available, etc. That's another good question to ask if you are looking around and interviewing. What are the scenarios that could lead to a transfer of care once I've begun midwifery care for out of hospital birth? So generally it is for low risk pregnancies and births. Home birth care also usually involves the prenatal care as well as the birth and postpartum and newborn care for some period of time after birth. In California, it's 6 weeks. My scope of practice allows for 6 weeks of postpartum and well newborn care. So that's another thing to think about in terms of the model. If you are working with a midwife planning a home birth, you don't necessarily need to also have a relationship with a physician. You can get all of your care done with your midwife and be able to stay home, not only for the birth, but afterwards for lactation support, newborn care and monitoring, postpartum healing and recovery, all of that. Just going back for a second to the birth center model, That may be available with birth centers as well, that the midwives provide continuity of care, although there is the change of location from home to birth center in labor and then back home after the baby is born. For most independent or freestanding birth centers, parents are going home somewhere between 4 and 12 hours after the baby is born. So just something to think about. Maybe that's a pro. Like, I want to get home. I've come here to do what I wanted to do, have this baby. I'm ready to get home to my other children, my pets, my own bed, etc. Whereas for other parents, they feel like that is abrupt. They don't want to be getting in the car at 4 hours postpartum with a brand new baby and getting themselves home and settled and all of that. They want either longer term care in the hospital with nurses who are available to help with baby changes or baby care questions or help monitor bleeding, etc. Or folks want to just never leave home, plan a home birth, and be there for the duration of the labor and tucked into their own bed afterwards. So, yeah, some considerations about the location changes or not. Something to think about. All right, let's see. Is there anything else I wanted to say about home birth? There's one thing I'll say about home birth is that one of the things that's really central to midwifery care, well, two things that are central to midwifery care. One is individualized care. So in the home birth model, you're much more likely to have one-on-one care with the midwife rather than like shift changes or that kind of thing. Although there are midwives who work in group practices. So again, check that out depending on where you are. And one of the benefits of one-to-one care is an individualized care plan. So a hospital is a big system, right? And there are some things that big systems do really, really well. And maybe you want those things for your birth. Or maybe it feels like I don't want to be part of a big system that's moving through a whole bunch of people in an efficient way. I want to slow down and have a relationship with a care provider and have a higher degree of choice and autonomy. And that's one of the strengths of the home birth model, is that there are many fewer like protocols that need to be followed or sort of generalized practices that happen for every birthing person. There's often much more autonomy and more time spent on informed choice and informed refusal. So home birth can be a good fit for people who want that. People who are having healthy pregnancies and healthy babies, people who are, in a place in the world where they have access to home birth care providers, and who want a high level of involvement and autonomy in their decision making. So again, for some people that works really well. They want to be making decisions about their own healthcare. They want to be getting into the nitty gritty of all of the choices that are available to them. And for others, it doesn't work so well. They would prefer a more contained process where they can sort of follow the standard steps like a hospital birth provides. Which isn't to say that there's no choice or no autonomy available in the hospital. That's not true, and I don't want to give that impression. There is still choice. There is still autonomy. You are still an independent human being. It just can be more limited in terms of the options that are available, or it can be, frankly, a little bit difficult to step too far outside of whatever the community norm is in the hospital. So if you want something that is outside of what is usually offered in the hospital, it can be a bit of a dance and a negotiation to try and achieve that. And, sometimes folks have success and sometimes they don't. So there can be a bit of a process of choosing your battles if you're looking to personalize or individualize the care to a greater extent. Okay, anything else I wanted to say about home birth? I guess I'll just say on the practical side, so aside from just like access and availability, are there midwives or other home birth providers in your area? The other piece has to do with, of course, the finances and the money for that. Um, that is also a big topic that's going to depend a lot on where you are, what type of provider you're working with, what type of insurance you have. I'll just briefly say there are some countries in the world where home birth is fully covered as a normal part of the healthcare system. There are other places in the world, like where I live, where midwifery care and planned home birth is covered by some insurance plans in some amount. It is rare to have a course of care fully covered and paid for by insurance where I live. And then there are going to be other places where insurance coverage is just not an option at all, or folks who are on like HMOs or managed care plans or public insurance, Medicare, something like that, Medicaid rather. There's typically no coverage for out of hospital birth. So that's really something to consider. And even in places where insurance does have some coverage, very often families are asked to pay upfront out of pocket first, and then to receive reimbursement from insurance after the birth has occurred. So that's just an important factor in decision making, right? Like what are the costs associated? What kinds of payment plans are available? What will work for your family? One nice thing about that model is that in most places, at least in the US, I can't speak to the rest of the world, but in most places, home birth care is provided at like a global fee or a package fee, where the full amount is known in advance, which gives families time to plan and to just know what their out-of-pocket cost is going to be. Whereas, again, in the US, hospital birth doesn't offer that option. And birth centers are going to be in between. You might get that, you might not get that. But hospital birth doesn't offer that option. You essentially go in, have the birth you have, billing occurs afterwards, and people find out how much they're going to owe after the fact. So it's sort of a trade-off that insurance is more likely to cover hospital birth at a higher rate, but the out-of-pocket costs might not be known until after the fact. And home birth care in most settings that I'm familiar with operates kind of the opposite way, where we know what the out-of-pocket cost or cap would be in advance, but we don't necessarily know what insurance reimbursement will be until after the fact. So again, something to take into consideration. All right. Also, midwives are trained as emergency first responders, and extensive training in health optimization and risk assessment. So people often have questions when it comes to home birth or any kind of out of hospital birth about, well, how do we know if something's going wrong and what happens if it is? And that's going to be another great question for your care provider, given that, you know, scope of practice varies and your clinical situation will have a bearing on that. But that's something to ask as well. And just for you all to know, if you're considering this option, that midwives typically have quite a bit of training in risk assessment and managing variations of normal and some complications in the out of hospital setting. So it's not necessarily the case that just any sort of variation or complication means a transfer of care. That's not necessarily the case. That being said, you know, we can't do surgery at home. We can't do an epidural at home. Our emergency equipment, supplies, and staff are different at home. There can be a delay in accessing some of the care that's available in a hospital if you need it, if you're starting off at home, whether you're going to go to the hospital in a car, private vehicle, or be calling an ambulance or EMS. And both of those things happen. Both of those types of transfers happen. Okay. I should have paid attention to how long I was talking about home birth. Just since I do that all the time, it's something I'm used to talking about, but I want to make sure that we equally cover everything. So I'm going to move on and just mention the option of a free birth. And what I mean when I say a free birth is a birth that is happening outside of the hospital, usually in a home, but could be anywhere, that is not attended by a midwife, a doctor, a nurse, a traditional birth attendant, even a doula necessarily. A free birth is something that people choose when they want to be totally undisturbed and not have any kind of monitoring or anyone else present in the birth space other than often the parents, or others might be invited, but no clinical personnel. The popularity of free birth, I think, has a lot to do with the attractiveness of being undisturbed, being in an instinctual place for giving birth. The idea of trusting the body and trusting birth. The downside for a free birth being that there is no monitoring going on and there is no one around who is trained in how to recognize problems as they develop or manage emergencies or complications if they arise. So when folks choose a free birth, they need to be prepared to take on that responsibility and just know that there is a trade-off that occurs for the independence and undisturbed nature of a free birth that is occurring without sort of the safety rails or the guidance of an experienced provider. So I think that's all I'm going to say about free birth. All right. So let's just, again, take a couple breaths here. That was a lot of content. I'm just going to take a moment. You might want to jot down any thoughts or ideas or questions that are coming to you after hearing all of that. Maybe shake out your body a little bit. It is likely that at least something that I said was a little bit activating or brought up some emotions, thoughts, memories for you. So just take a moment. Maybe you want to move your body, bring some water. Okay. So that was our gathering portion of the presentation today. And I would like to begin to shift us to a little bit of hunting on the inside. And so the question that comes up as we shift gears here is like, okay, great. Here's all this information that we've gathered and talked about and many different things to think about and consider. But how do you actually decide? How do you make the decision? Now, there will be cases where it's very clear what the decision is, and there doesn't need to be a lot of back and forth or a lot of deep consideration. It might be very obvious and very clear based on availability, health, finances, etc. But even beyond that, I want to invite you into thinking about how you know the things you know, how you know to decide in one direction or another. How do you know what to go towards and what to move away from? And one framework that we use in Birthing from Within is called the 3 ways of knowing. Now, you could argue that there are more ways than this of knowing, but it's useful. It's useful to have a framework to hold us a little bit. So in our 3 ways of knowing framework, the first one we call primordial knowing, or sometimes instinctive knowing, or even in the bones knowing. Now that is just your instinct, your intuition, something that you know and you don't know how you know it. In birth, that can look like, spontaneously moving into a position that you never thought of before, but just somehow you knew to do it. And that happens all the time in life when we have small and large decisions in front of us or turning points where sometimes we just can't describe why or how we knew what to choose or which way to go, but somehow our bones spoke to us. It's not a rational, linear process. It's just something that bubbles to the surface. So that's primordial or instinctive or in the bones knowing. So you might consider right now, what do you know in your bones? What is your intuition about where is the right place for you to give birth? And if you want to pause the video and make some notes, please go ahead. When you're ready, you can come on back. And we will introduce the second way of knowing, which is called modern knowing. Now, modern knowing has to do with just what it sounds like, understanding the world we're living in, right? There's a lot of modern knowing in this course. What are pros and cons of different birth locations? What happens at this one that doesn't happen at this one? Modern knowing also includes, needing to understand the tests that are available and offered to you, the common practices and interventions at your hospital, your midwife's usual way of handling transfers, right? Those are all modern knowing things. And that's important. We need to know that. We need to ask those questions and gather that information. Looking at evidence, right? And thinking through things in a rational way, making a pros and cons list, right? That's all falling under modern knowing. So again, you might be thinking about what do you need to know on a modern knowing level? What questions do you have about your local birth center that you want to have answered before you make a decision? And then the third way of knowing is what we call knowing thyself, self-knowing. And this is, in a way, for many things that come up around birth, pregnancy, parenting, this is the most important type. Not to say the only important type, but can be the most important and also the most often overlooked. So self-knowing means understanding where you are coming from with the life experiences that you have, what you know about yourself that no one else could tell you, what you know about the culture that you are living in, or that you came from, your own values and needs, what is most important to you in your birth process. That is self-knowing. And when we start to examine self-knowing as a way of making decisions, it can be a really powerful guide. So for example, if I know that a core value I have in birth is feeling connected to my baby, there are a lot of ways that I might get there, right? So instead of starting with the outside of thinking about, I need to be in a birth location that has skin to skin available to me after birth, or I need to be in a place that offers rooming in and doesn't take baby to nursery. Those are external things that might signal that value of feeling connected to my baby, but they aren't the value in and of themselves. Does that make sense? So when you can dial in on what are my values, what do I know about myself? And in this example, it's that I want to feel connected to my baby. Then my planning and my preparation starts to look really different. I'm geared towards what are all the ways that I can feel connected to my baby. And maybe skin to skin and rooming in is part of that. But also, I might be having a deeper conversation with myself about, if skin to skin isn't available for some reason. Maybe baby needs to be in the nursery for a while for some support, and I can't hold them skin to skin for a long time. What's another way that I might feel connected to baby? Maybe it's just sending a breath from my heart to theirs. Maybe it's having my partner take pictures of babies so that I can look at them during the time that we're separated. Maybe it is choosing a lullaby that I sing to the baby every day in pregnancy, and I can also sing it to them after birth. Right? So there are lots of ways to go about decisions and choices when we get tuned into to self-knowing. Now, another part of self-knowing that I just want to highlight a little bit here, and if you go further with Birthing from Within, there's a much deeper exploration of this in a few places. But I want to just highlight the difference between what we might call conscious preparation. So that's often the gatherer, right? We talked about that, looking around at experts and information and gathering. That's our conscious preparation. We're thinking about how am I going to make this decision and what do I need to know? And then there's also unconscious preparation. And unconscious preparation is everything we have learned about ourselves and about birth through our lives up to now. We all have absorbed ideas, opinions, beliefs, assumptions, emotions about birth just from living in the world, hearing stories, maybe witnessing a pet give birth, maybe having siblings, having our own children, seeing birth on TV or movies, reading books and stories, religious stories like the Nativity, right? We are absorbing information about birth and parenting, babies, doctors, midwives, etc., throughout our lives, not on purpose because we're seeking it out, but just through living. And that happens with birth, and it also happens with really just everything. We're absorbing information, and that is what we call in Birthing from Within our unconscious preparation, right? There is some wiring, some assumptions, some beliefs that are in there that we didn't seek out and don't necessarily come from our rational minds. And so part of the power of reflecting on self-knowing is about noticing the unconscious preparation that has happened throughout our lives that is having a quiet but powerful influence on how we feel, what we believe, what we're looking for. And so when we ask the question, how do I know this? Right? When I consider a birth location, how do I know that I want to learn more about this one and I want to stay away from this one? How do I know that? Where did that come from? Even before I do all of the information gathering and the pros and cons list and all of that, there's something inside of me that is drawing me towards some things and away from some other things. And again, there is no right or wrong in this. There's no judgment in it at all. It's just part of being human. And the beautiful part is that when we start to get familiar with that background uh, programming or learning, I'll call it, when we begin to get familiar with that, it really opens up some possibilities. We might learn that, oh, yeah, actually, my rational mind, my today mind is in agreement with some of that earlier learning. Great, good to go. Or we might also have the experience of like, where did that come from? And why am I so connected to that? And does that make sense for me now? Where I am in my life now, and the decisions that are in front of me now, and what my current values and beliefs and knowledge are. Does this make sense? Does it match? Or do I want to shift it? Do I actually want to learn more about something that I had written off before? What would happen if I looked at this in a different way now? Now that I'm holding space for the unconscious learning as well as the conscious learning, knowing, and decision making. So, in our last few minutes here on this call, I'd like to offer you a little activity you can do to begin to explore this for yourself. Okay. So, what you'll do is you will get a piece of paper and divide it into 4 quadrants. So, just make like a big plus sign in the middle of your paper. So, you've got 4 equal quadrants. And in one of them, you're going to put a heading of modern knowing, or you might call it evidence-based knowing or information. The second one will be personal values and intuition. The third will be social and cultural influences. And the fourth quadrant will be practical or logistical considerations. So that last one, practical or logistical, you will write, okay, so for each of the quadrants, you'll take a few minutes and just jot down what your ideas are, what you know so far, and what questions come up for you as you start to investigate this. So it can be as short or as long as you want. So the evidence-based or modern knowing quadrant, you're going to write down things that are important to you in that regard, right? Like what kinds of services are available at the birth location that you choose? What kind of safety setup is there? What kind of comfort measures are available, etc. In the personal values and intuition, that's probably fairly straightforward. You know, what is most important to you about this process? What do you most care about? And try and drill down to a values level rather than a specific circumstances level. Because, you know, the reality is in birth, we have influence, we do not have control. And when we make decisions based on needing to have a certain outcome, like in the example I gave earlier, like needing to have that skin to skin, and if something occurs where skin to skin isn't possible, if we've put all of our eggs in that basket, it can be pretty devastating if it doesn't or can't occur for some reason. But when we drill down to a values level, we have much more influence over all of the ways that we can stay connected to our values, even if some of the circumstances that we're hoping for in our birth don't or can't happen. So consider what your values are. What is most important to you in your birth and birth location? In the social and cultural influences, you might jot down notes about your family values, your family of origin, the things that are meaningful to you as cultural traditions, spiritual traditions, family traditions, influences on your decision making that come from the relationships in your life with individuals or with culture. And then in the practical or logistical section, you will jot down notes about things like accessibility, location, cost, insurance, those kinds of things. Like, can I get to this location? If I'm interested in a home birth, is there a home birth midwife who serves my area? If I am looking at hospitals, is there only one hospital available for me to choose, or are there different hospitals to compare? And how might I know which one is right for me? Um, if there is cost concerns, what do I need to know about that? What's available? Is there insurance coverage? Is there a payment plan? Um, all of those kinds of things go into the practical or logistical category. So again, you might pause the video here and fill in your quadrants and just see where that takes you. And then lastly, I want to leave you with a few more questions to reflect on, ask yourself, journal about, just let them kind of in the hopper as you are beginning to make this decision. And again, this is about kind of engaging more with the unconscious preparation part of us that most of us haven't thought about at all. Most of us haven't at all thought about, like, where do these ideas that I have come from? This sort of sense I have about what is quote unquote right or wrong in birth, where does that actually come from? And do I agree with it? Do I agree with it? When I bring all of my ways of knowing together, do I agree with it? So the first question to ask yourself is, what do I believe or assume to be true about birth? You could also tailor that to be about birth location. What do I believe or assume to be true about hospital birth, birth center birth, home birth, free birth? What are my beliefs and assumptions? And just let it come out. There's no judgment on what comes up. It can be very enlightening to see, like, oh, what's actually in there? What are the beliefs and assumptions I'm operating on? And then later you can look at, do I agree with that? Is that correct? Or do I need more information? Or do I know for sure that's actually old and outdated and I want to operate from new information? Okay. The next question I sort of led into before, which is just simply, from where does this thought or belief come? These beliefs and assumptions that I have about birth or birth locations, where do they come from? Can I identify where I got this idea from? And the source of that idea might tell you something about how meaningful or how potent it is in your psyche. Something that you saw on TV 3 weeks ago might bear less weight than a story you've heard told in your family your whole life, right? So just something to reflect on. If there are emotions associated with any of these birth locations or anything that came up in your 4 quadrants or the previous questions, from where does this emotion arise? Where does this emotion come from? What is it connected to? What is being expressed through me right now? How do I know to feel this way? How do I know to feel this way? In other words, how did I learn this? How did I learn that this thought and this emotion go together? And then also, how does it help to feel this way? How is this serving me? We tend to only hang on to and operate off of things that are working for us on some level. Now, that doesn't mean to say that they're like super functional and great for us at all times, but on some level, they're working for us. They are helping us in some way. Now, very often, if we really take this all the way to the root, the way that it's helping us is in some way helping us feel like we belong, helping us feel loved, helping us feel connected, helping us feel congruent or matching with our values or the values of our family or community. Very often, the ways that our beliefs, ideas, and emotions are helping us are in our protecting ourselves and helping us feel loved and belonging. So just see if there's any of that coming up for you. And then lastly, what is motivating me towards or away from whatever I'm thinking about right now? What is motivating me towards a particular birth location and away from another one? What is motivating me to read a certain book and avoid another book, or to take a particular class and not another one? How do I know to do that? That happened inside of me before I did the gathering, right? Or maybe partly as I did the gathering, I looked around at what classes and what books were available, and something in me made a decision about which to go towards and which to go away from. So just ask yourself, what is motivating me to do that? Again, how do I know to do this? And how do I know not to do this? And as we come to completion of this call today, you may have some new clarity. You may have some new confusion or questions. You may be on the lookout for more information that your gatherer is hungry for. You may find yourself leaning towards deeper self-reflection and spending some more time hunting on the inside. But whatever the case may be, as we close the call, I would like you to consider for yourself, from wherever you find yourself right now in your decision-making process, what is your next small step? Or you might consider it as your first small step. From here, with what you know and what you feel and what you're learning, what is next for you? Just the next step. It can be overwhelming to think about. Maybe you're not ready to fully make your birth location decision, or maybe you are, but you've got all kinds of other things to think about and consider and prepare for in birth, and it can really feel overwhelming. So we don't need to plan all of that out right now and figure it all out. But what can be helpful to do is to commit to your next small step. Maybe that is reading an article about home birth. Maybe it is looking up some stats for your local hospital about what their cesarean rate is. Maybe it is some journaling about how you got here and what your values are. Maybe it is connecting with your partner or a friend to talk through what you're thinking and what's coming up for you. It could be anything. So as we close, just take a moment and commit to whatever your next small step is along this journey. Take 3 deep breaths to anchor yourself, come back into your body. I want to thank you and appreciate you for being here with me, enjoying this recording and doing this deep work of welcoming new life. So thanks so much all for being here, and I look forward to seeing you next time.